Hey guys, hello. Let me see if I can. I don't know how to blur the background, but whatever. If the background's not blurred, that's fine. Hi everyone. Let me see. How do I do that? Channel level? I don't know. That's fine. You guys can see the construction behind. That's what life in New York City is like. You get a nice view, and then all of a sudden they put a building up. That's how it goes. And sorry for my voice. It's like I'd lost my voice partially, and then it's starting to come back. So we'll see how long this live lasts, as long as my voice lasts. But thanks for joining. So here we go. Okay. Can everyone see me? Okay. Hey, Rick. Hello, Mr. Sabsucks, Jonathan, Hillary, Mina. Hi, everyone. I hope you're enjoying your Saturday or whatever day it is where you're located. Here we go. Bara says it's the middle of the night in Europe where she is, so sorry about that. Just decided to do this spur of the moment kind of thing. Let's see. Someone's asking, what are the available procedures for a cleft chin? Well, the non-surgical option there is to just do some Botox. Sometimes it depends on what's causing the cleft. If it's just like some so there's different types of things that can occur here, right? Sometimes it's a cleft. Sometimes it's just like kind of the area is just looking like it's like not dimpling but ruffled a little bit, like wrinkly. So Botox can be used for that. If it's a true cleft, then filler, either HA filler or fat transfer, for example. And there are some surgeries to help bring those deeper muscles, mentalis muscles, closer together. So there are a couple options there. Um, Joanna wants to know my motivation for choosing a career as a cosmetic plastic surgeon. It's like life guides you in interesting ways. I love art and I love the human body, learning about it. I like surgery. I like working with my hands and, trying to, make things better for people. So I don't know, altogether that, and I like psychology and how we think about different things. So all that brought me to what I do today, I guess. Here we go. So Catherine's asking, I was attacked and I have the scar on my face and it won't go away from the attack. This happened at the end of August last year. Well, so that's like what, 8 months? Scars take time to heal, especially on the face. It can take like a year, and sometimes even longer for the scar to actually mature. So, we talk about scar gel. We have a video about, scar tissue and how it forms and why it forms and how to treat it. Um, and the Feel Confident Scar Gel is an option, but sometimes you just need a surgical revision depending on how the scar looks. If it wasn't properly stitched up, or sometimes even if it was done well, you might need to do it again. It sometimes happens. Occasionally, lasers can help, or microneedling at times. Scar gel is usually a good option. Make sure to also cover it with sunscreen or sunblock to protect it. So those are different ways, but again, each scar is very different, and you need sometimes steroids are needed to flatten the scar because it can be raised. So lots of different things. So each scar is assessed and evaluated, differently, um, depending on also who you go see. But yeah, but those are some of my thoughts. Jesse, I had SMP done before I decided to get a hair transplant. If I decide, that's scalp micropigmentation. We have a long form video on that with my buddy Jonathan Giro, who's an outstanding SMP artist. If I decide to grow my hair back after the transplant and only remove scalp micropigmentation done on my hairline, is it going to look two-toned? Well, depends how the removal goes. Generally, if you're going to remove the pigmentation, I'd recommend doing it before the transplant so that your transplant surgeon has a cleaner slate to do the transplant on. If a doctor only does IV sedation, in his in-office surgery room, is it okay that it's not fully accredited? No, that's not okay. IV sedation should be done only in an accredited facility. Um, the body that I'm accredited with is Quad A, and that's one. There's other accreditation bodies, but you don't want to be doing IV sedation with an anesthesiologist in a non-accredited facility, in my opinion. There's a lot of things that I think can go wrong. So you want to make sure that all the different protocols and safety mechanisms are in place and being followed. Make sure that there we go. Okay. All right. Nothing from Mark, my amazing moderator and YouTube manager. So I think we're doing okay here. Okay. So we're going to answer all these other questions. Lots of people asking. Thank you. I wanted to remind you all that the Feel Confident products are finally available on feelconfident.com. So Mark will add the link to the chat for you guys to go and check out the products and hopefully, get something. So we'd appreciate it. A lot of time and money and effort has been spent on like putting all these products together. So we can't wait to get it into your hands and see how you like them. I'm always open to feedback. Some people come onto the channel and post nasty things. That's not always constructive. But for the rest of you who give us feedback and give us ways to improve in a constructive way, we are always open to that, and we appreciate it. And we also appreciate all the people who are always positive and just kind of applaud some of the stuff that we do. That also gives us motivation to keep going. So finally, I know I pushed back the release. We pinned the website, so we pushed back the release of these products for so many months. So, and there've been so many reasons for these delays that were like outside of my control. But I'm pretty like careful about a lot of things, including all the stuff that we do with the products. So we don't want to release things until they're as optimal as they can be. The moisturizer, the only thing holding that one up is the labeling. So the screen printing company printed these labels and it was like peeling off, which was ridiculous because like we only realized that after the manufacturer already filled these bottles and then we got like samples of them. We're like, why is like the outside ink coming off? So that was not good. So now we're waiting on brand new labels to be made so that we could label all of the bottles that we already have, that are like ready to go. We just need a new label. So anyway, once that process finishes, which is hopefully 1 to 2 weeks, they tell me, then we'll get that to the warehouse, and then that will also be available. We have a bunch of content coming out that's geared more towards the products. Obviously, it's not going to replace all the other content, but it's just going to be like extra stuff. Uh, some of it is meant to be, educational, of course. Some of it is a mix of like, trying to show off the new brand. Listen, it's marketing and it's education. So I hope you guys like it. It's maybe a little different from some of the other stuff that we talk about, but I think it's very much interconnected with all of our other work and other videos. So we'll see. But we're putting a lot of effort and energy into those videos. They're not just like some, little silly thing. They're professionally made and should be, I think, really interesting to people. And they talk a lot about beauty and wellness and health. So anyway, and then I've got the podcast going too. We have guests lined up. We have, more podcasts coming out. The views on them haven't been great. There's different theories as to why. I think people aren't used to these longer formats on our channel, and maybe we've got to spruce up the titles and thumbnails a little bit. But anyway, we're working on it. I've really enjoyed sitting down with like true professionals in whatever field that they're in. Mostly medicine, plastic so far, but like dermatologists. But we're gonna expand beyond that. I have entrepreneurial interests, as you guys know. I have a private practice. I've got this Feel Confident brand. So we want to talk to people who are also in that space, and doing their own thing. And I think there's a lot of interesting crossover there. And then, lots of different people related to hair, who either talk a lot about hair loss or about different types of hair related topics that aren't necessarily transplant surgeons. We'll be sitting down with them, and then I don't know, other interesting people in art, um, and in beauty, but like beauty from other perspectives. So I've reached out to a few chefs that I'd love to sit down and talk to about how they view like the art of food, right? Like that would be super interesting. So basically, things that like I got to do things that interest me too. I can't just create stuff that a certain portion of our audience like craves. It's going to continue to be a mix because I think the more you guys see passion in the things that I'm doing, hopefully the more it connects with the audience. And we realize that there's going to be different audiences. Some people don't like like they don't watch our channel for the hair stuff at all. Other people only watch for the hair stuff. Like it's fine, but we want a multi-dimensional channel that speaks to different people and gets to like deeper themes in all of this, right? Because truth is, plastic surgery, it's a broader like theme concept. It's not just like the technicalities of it, but it's like why are we doing all this? Like why do people do anything related to how they look, beauty, aesthetics? Like why is it relevant at all? Um, it'd be fun to get to these deeper themes, and that's kind of like I guess what I want more of my legacy to be, rather than just um, doing the technical work well. I think that's great, but I think it's fun to explore deeper meanings. Anyway, I'll stop rambling. Okay. Manofeet. Doc, please make a detailed video on self-harm scars. They're a bit raised and white, pale in color. How do you treat them? Well, whether they're from self-harm, which hopefully, that's all in the past for you, um, or scars from surgery or scars from other forms of trauma, they're all you know, basically dealt with in similar ways. So again, check out that video we have on scarring. Maybe Mark, if you can post that video somewhere in this chat, people can check it out. But it's like all about scarring. And we have a separate video about acne scarring. So if you search like Linkov acne scarring or Linkov scar treatment or something like that, you'll see them pop up in YouTube. Uh, okay, so we've got how to remove under the chin extra skin from weight loss. Well, it's not always extra skin. Sometimes there's extra fat, and there's non-surgical ways. We've got a video on that too. Of course, all these videos after the last few years, uh, and there's ways to remove that fat. The skin you can only really remove two ways. One is you can cut here, do a direct submental plasty, essentially. Usually that's done for like if it's going to be done at all for older men, it's just like women usually don't want a scar right here, and older guys, it's like they don't usually want scars around their ears. So that's like the most common demographic for the extra skin direct removal. But the more classic way is to remove the skin out here by pulling. So then this tightens, and that's a facelift, right? Lower face, mid face type of lift. And then non-surgically, if you were to remove fat, that can be done with like liposuction. It can be done with Kybella, cool sculpting. Maybe those are less effective ways, in my opinion. But anyway, those are ways. And then if you need to get to the deep fat, which some people have fat deep to their platysma muscle, you get to that through a direct approach. So one small incision, or like an inch or so, inch and a half under the chin, can get you there. So it's not always just excess tissue, is my point. Okay, let's scroll down. I always have a tendency of not scrolling down, so here we go. I want a nose like MJ, says Kenny DC. Um, you're definitely in the minority there, and I can't help you. Uh, Matt, any advice on treating recurring scalp inflammation? Well, a lot of times the inflammation is part of like a seborrheic dermatitis situation. Ketoconazole, which is also sold under Nizoral as a brand name, like 1%. You can get a 2%. kind of through prescription. That's a decent option, applying that like twice a week. And then there's like more, steroid type of treatments, like clobetasol shampoo and stuff like that. You might want to talk to a dermatologist to see how severe that inflammation is, and then maybe there's another root cause for you. So definitely get that evaluated. Is telling me I'm living for your facial hair. Look, I don't have that much hair left on my body, so whatever I have, whenever it comes decides to show its face, I'll take it, and I'll sport it. And for my videos, sometimes I'll just shave it down because the stash is kind of funny, but that's all I got. So I'm gonna continue to sport it. Kevin's annoyed that I skipped his question. Why don't you ask it again, Kevin? Because I can't answer everyone's questions. Don't get frustrated on us, Kevin. Um, well, Lookman is saying good evening. Hello. Does rosemary oil really help hair regrow? There's no good data to support that. We have a long form video on different supplements on related to hair regrowth and what's actually been shown to help in the literature. And based on that video, by the way, from a year ago, I selected the compounds that seem to work the best, and that's what I put into our new shampoo, conditioner, our feel confident stuff. And I'll show you guys. I have a sample. Hold on. Oh, where did my wife put the? Hold on, it's coming. All right, I'm coming back. All right, here we go. We have one at home. So this thing here, the shampoo, right? So these key ingredients, they're also on the side, is what's been shown to actually help in the literature. Saw palmetto, pumpkin seed oil, curcumin, caffeine. There's anti-inflammatory properties as well to a few of them, and improving kind of blood stimulation, blood flow. That also is there, but all four are DHT blockers, natural DHT blockers. So kind of like finasteride, but like less potent, right? And so that's what we put in there. Now, some people are like, well, is it going to do anything because it's just on your scalp? Well, we know that topical finasteride works, to a degree. Um, so I think shampoos can be helpful, but don't think of them as replacements, for the actual prescription medications. Rosemary oil did not make the cut into my shampoo and conditioner and foam and into our hair products. So I guess just keep that in mind. And the other exciting thing is that we have a bunch of products that are already formulated and tested, but not yet like put into bottles. We haven't actually even picked the bottle and the size and all of that. So we have a beard serum that's going to come out. I don't know. We'll see when, maybe end of year. We have an eyelash eyebrow serum as well. That's been working really nicely for the people, at least that we know that we've given it to try it out from an efficacy standpoint. And eventually I'll invest some money into like actually getting more clinical data on some of these products, to make you guys feel even more comfortable with them. It's expensive, so a lot of companies don't do that, but I think we'll eventually invest into that as well. But anyway, rosemary oil would not be my first choice. What else? Do eyelash serums work? What's the active ingredient? Um, well, good question. There's different kinds of eyelash serums, and some of them have like Latisse, or Latisse is Bernatoprost. Let me see the exact pronunciation. Latisse. Bimatoprost. I was right. Bimatoprost. So that is like a prostaglandin, and that's in Latisse, and that can help with some regrowth. The problem is you can get reduction of fat around the eye when you use it. So many eyelash eyebrow serums these days keep prostaglandin analogs out, and instead there are different peptides that can help with regrowth as well. So we put a bunch of these peptides into like our moisturizer, for example, um, and the peptides are going to be also in the eyelash eyebrow, so that can helps with stimulating growth to a degree. All right. What else? Let's see. Questions. I want to relax. I sip slowly asks, I want to relax my jaw muscles, but I wonder how it could affect my chewing. Well, I'm not sure if she's saying or he's saying relax the jaw muscles with like exercises or maybe with some Botox. But let's say you put Botox into the masseter muscles to either for cosmetic purposes to kind of slim this down or because you want to combat TMJ. People are still able to eat fine, assuming like it's a standard dose. Usually, I would do about like 20 units per side. It's pretty standard dose. So with that, I've never had problems with people, not being able to chew. Live one day at a time is saying, Doctor, how long can a revision rhinoplasty last? Well, that's a good question. I mean, most people will say, rhinoplasties are just permanent. The truth is that there are some changes that occur to our all of our, noses as we age, and also when you get a surgery, you don't exactly know how it's going to look, years later. I mean, hopefully it looks about the same, but cartilages can shift, and with revision cases, usually there's a lot of grafting that goes on. Those grafts can shift over time, so just something to be aware of. So it's hard to specifically give you, a number of years that it will last. It depends on the scenario, the individual, the surgery, all those things. Jay Kofi, have you talked about retrograde alopecia before? We've mentioned it for sure. I'm not sure if it warrants a dedicated video, but basically the concept is that with retrograde alopecia, you've got hair that's receding, but from the bottom up. So if you think of the crown receding down, and then if someone has retrograde alopecia, the hairline is coming up from like the hair down here, the occipital scalp hairline in that sense, not this hairline. It's coming up and the crown's coming down. So your DHT resistant zone or your classic, donor zone for harvesting is going to be quite narrow. And that's one of the issues for, for transplanting, especially with FUE. What else? So someone's asking, Kejcio, what are the blood tests to confirm hair loss as androgenic alopecia? There's no blood test to confirm that. These are patterns, whether they're male patterns or female patterns, but they're patterns that are observed. That's why it's called pattern hair loss. There's actually, basic patterns. And there's lots of variations on those patterns, but there's still like general patterns that will point to specifically androgenic alopecia for men or for women. And there are some biopsies. Like if you do a biopsy, there are some signals to a dermatopathologist or a pathologist who's viewing the stuff under the microscope that it might be androgenic alopecia. Like they see miniaturized follicles, and that could also give you some information if you're not sure when you're just looking at the clinical scenario and hearing like the clinical story. So the history, the progression of the hair loss needs to make sense and the pattern needs to make sense. You don't like request blood work looking for androgenic alopecia. Yeah, I sip slowly was talking about Botox, and that's what I answered earlier about the masseter muscles. Midtown Madness. I wonder if you're in New York City. What is your opinion? What is what is in your opinion the biggest indicators or visual maybe of visual aging? I notice people having thinner skin around the eyes. Can cream products make it look younger? We're actually working on an under eye cream to help mask some of the signs of aging, um, like the darker circles that I of course have. And my daughter recently pointed that out. I've been working a lot. I always work a lot, anyway. But I also just have like a hollowing, so that makes it look like that. So under eye creams, masks can help. uh, if you really want an impactful change, then you might need to consider like a surgical procedure, whether it's like or non-surgical filler or like fat transfer or a lower blepharoplasty can help. But sure, that's a visual sign of aging. There's lots of others, skin getting more wrinkled, the face starting to drop and sag, and you get marionette lines, and you get nasolabial folds that deepen, and you get jowling, right? I mean, those are some of the changes. The philtrum gets longer. The bone, muscle, and skin starts to kind of atrophy. So you get these bony changes. So some of the changes that you see around the eyes are not just from the actual like surface change. It's actually from the bone that's starting to degrade, right? So it's kind of sad to think about, and not a fun thought. But as we, especially over the age of 25, our bone density slowly starts to diminish. Usually around 25, it peaks, and then that bone density starts to slowly trail off. So kind of sad, but that's what happens. And so you see those changes, the orbits getting bigger, and things are dropping in because you have this expansion of the orbit and a thinning of it. Who else? John wants to know how closely to one's natural density can be achieved over multiple hair transplants. I mean, you can come pretty damn close, but it depends on like what your starting point is. So if you're starting on a bare area, you cannot get to original density with a single surgery, and that's because it's like you have to. There's like a limitation to surgery, right? You have to create a unique home, a unique site for each graft. And in order to do that and not fuse all your sites, because once you start fusing your sites, you can't control the angle, the direction anymore. You risk having low blood supply to the area, so your grafts might not survive. The skin in the area might die. So you don't want that. So in order to keep it safe and keep it distinct with your little sites, usually we can achieve a density of maximum, I'd say, I don't know, 70% would be like probably more than we usually achieve, off of an initial surgery. And then, you have to do another one to get more density. But what if you're starting with a density of about 50%? Well, if you go high density surgically into an area that's about 50% depleted, then there's a chance that you might come very close to original density with a single surgery. So that's the concept. It depends on, what things look like before you actually do the surgery. So if you're working on a really big area, you have a limited number of grafts, right? What you always do with a single surgery, limited number of grafts. You can't possibly go high density on a very large area of coverage. So oftentimes we're competing between coverage and density. So also I want to tell you guys, look at this badass BandAid. You see it? You see what this is? It's a princess BandAid. It's apparently the only BandAid that we have in this apartment because my daughter, who's 5, almost 5, she loves princesses, and this is the type of BandAid that I have. Right, Lily? We got the princess BandAid. You want to say hi to the people? Okay. What do you want to tell them? But it's got to be something appropriate. Nothing bad. What do you want to tell them?
Nothing.
Nothing? You're getting shy?
It's okay.
That's okay. Look at all these people. They're from all around the world. Some might even be from Paris or France, where we're going on vacation in a few months, right?
And where we're going right now, Roosevelt Island.
Roosevelt Island. Okay. Have fun, okay? Thanks for the BandAid.
Awesome.
That's pretty cool, right? Yeah. Okay. Okay. Bye. Have fun. So yeah, so when you guys ask me to make more videos, you got to remember, I'm a dad. I'm a dad first. What?
No.
Yeah, I'm a dad, husband, son. So thanks. So, I've got home responsibilities. So sometimes, I don't get to the video prep on time, and I've got to listen at the end of the day. Also, first things first, I got to do surgery. So, my patients come first, uh, family, patients, and then, all of this educational stuff that we do and everything else that we do online. But I love creating stuff for you guys. You know that. We'll keep doing it. We're not planning on slowing down, but there's a lot to always juggle. So we do our best. I do my best. All right. Yes. Rocky family first. Yes. And patience. I mean, my patients get my undivided attention. Jesse wants to know, why do you think most plastic surgeons never get plastic surgery themselves? That's actually false, Jesse, based on the literature. There have been studies looking at that, and it's actually a very high percentage. It's something like close to two-thirds will get some sort of, like, especially cosmetic surgeons will get some sort of treatment. I mean, maybe it's not a full-on surgery, but it'll be like, laser treatment or chemical peel or something, and many actually get surgeries too. Um, so that's not true. Um, Me personally, I mean, I haven't really had a need for any surgery yet. I'm not like saying, I mean, what have I had? I've had one surgery, nothing cosmetic related when I was younger, and then nothing too major, and then I had like a sty on my eye, and I got that cut out like a year ago. So that was kind of a minor procedure, but again, not so much like major surgery. Um, yeah, you guys have asked me this, like if I could get something done, like what would it be? I have the answer. Yeah, and some people might be like, maybe it's your nose. Maybe you got to get that smaller. But I actually like my nose, so it won't be that. But my under eye area, if I could do something about it, that would be a little bit more long lasting. I would love that. So maybe like a lower blepharoplasty or something, maybe fat transfer into that zone. But I mean, I can't deal with that downtime right now in my life. Nor am I like really, really bothered by it, right? But over time, listen, things change. If it starts to annoy me more, if it becomes more obvious, um, I know people. I know people, so I know where to go to get it done. But yeah, look, it's about taking calculated risks in life, right? It's not. Um, oh, Gail wants to know when the under eye product will be available. So we've got all these other products that are more like closer to being, ready. Um, Namely the beard serum, eyelash eyebrow serum, and we actually made our own lip balm because many of our lip lift patients get a lip balm. And then, when I'm giving out another company's stuff, I'm always like, well, maybe we can make it a little better. So anyway, that's how my mind works. Uh, so we made our own, and so that's also, so those are probably like the next three products that will eventually launch. If things go well with these, then maybe even towards the end of the year potentially. And then um, the under eye cream is like something probably for next year is my guess. But you always have to be a couple steps ahead. And some people don't create like a lot of new products, right? They just start with like one thing. We had a scar gel for a year, right? We didn't really push it too much on the marketing side, just because I don't know, it wasn't really a priority, and it was just kind of a standalone item and whatever. But now, along with everything else, we're pushing the scar gel as well. But we've been giving it out to our patients for like literally like probably a year and a half. So, we've given it to, I don't know, thousands of people. And then other people, purchased it online. Probably over 1,000 have purchased it. And then, I don't know, maybe 1,000 have gotten it through our office. So lots of people have tried the scar gel and overall really like it. So anyway, we'll see how these products do and we'll go from there. But I do think I don't want to have like a million products and confuse people, but I also want to have products that are specific to different potential needs. Um, so anyway, and I want most of them to be gender neutral because I feel strongly that guys should be focused on their skin as well, and then not just their hair. And then for women, lots of women have hair loss, and somehow it's not talked about often enough. And they're looking for solutions too. So I want the hair products to be accessible and not just be for the men. But of course, some of the products like an eyelash eyebrow serum, I would imagine would, maybe be used more by women. And then the beard serum would probably be used more by men. So anyway, some stuff will be gender specific ish, but there's gender fluidity these days, right? So who really cares as long as it's something that, people like. people can get some value out of, some utility, I'm all for it. So I can't wait for you guys to try it. Let me know your thoughts, and that'll be fun. Uh, Kaiser wants to know, is getting into a plastic surgery specialization in the USA very difficult? In my country, it's the most limited specialization, the hardest to get into. Yeah, I mean, it's super competitive for sure. It's even harder if you just want to do like cosmetic surgery because, for obvious reasons. But, you know, I think like the other problem with that though is that like some people who are really smart, they go into it, but they don't have like there's no passion. There's no like, this is really what I want to do. It's just kind of they're doing it. They're doing it. They're making money. It's fine. Um, but I always wish for people that they find their like passion in life, and then it truly. I mean, it really doesn't feel like a job. I don't know. Like for me. Um, I don't know, like, there's no distinction. I mean, sure, when I'm, like, playing with my daughter or hanging out with my wife, like, that is, I guess, separate, but then again, my wife helps me with a lot of stuff with, the work that we do with the products and the practice as well on the back end. So, so we're always kinda talking about that. Something in my mouth. But yeah, so it's, I don't know, it all just kind of is one thing. Um so it's fine, and I prefer it that way than having like, oh, okay, like I'm at work and then I'm at home and I don't want to think about work. Like, no, for me it's fun. Like I check the messages, I check, patients texting me questions, um, you guys posting comments, emailing us, like all that stuff. It's like it's fun, it's dynamic. Does it get overwhelming at times? Maybe, but then I just like whatever. I'm just grateful overall. So it all works out. Joseph wants to know how I feel about superorbital implants and the brow ridge. Look, I'm not the biggest fan of silicone implants in general. I mean, there are some, great use cases. I think chin implants, it's really can be great. I think superorbital implants, becomes very tricky. The positioning, you might see an exact outline, of them. Yeah, it just has to be truly done in the right patient. Uh, and then I really don't like implants in the nose. Like, that is not a great place for them, even though they're commonly used. And I also don't like them in the lips. So, some people put them into the temp. I mean, they'll put silicone anywhere, into the calves, right? There's people walking around with calf implants, all types of areas. I mean, cheek is a pretty common area. I would say, cheek, chin, pretty standard. But other areas, it becomes kind of weird looking sometimes. JL, are you a squeamish person? Do you have to get used to it at first in the early surgeries? I mean, I wouldn't say that I'm squeamish, but yeah, I mean, some of the stuff you see, especially in medical school, um, yeah, it takes some getting used to. That's a good way to put it. Um, but I mean, I also was never like, oh my God, blood. Like, I think if that's you, then surgery is probably not the answer. But you gain an appreciation for certain things. The interesting thing about blood, um, the way I see it these days, like going through all the stuff that I went through and doing what I do for a living, uh, I see it as life. Especially when it's bright red. That's life. That's oxygenated blood. That's like delivering nutrition and energy to your organs and traveling around and doing its thing, and that's like a beautiful thing. um when you don't see blood when you're in the cadaver lab, that's a problem. That's not a that's a sign of no life. So you kind of start to appreciate actually like blood for what it is and not see it as some weird scary thing. um, and then in surgery, in terms of blood loss, and you have lots of tools at your disposal for controlling the bleeding. So yeah, I mean, I've been in some tricky situations, especially during more of my head and neck surgery days, where you get into some like lot of bleeding. I mean, we deal with big blood vessels. So yeah, I mean, can it be scary at times when someone's bleeding heavily during a surgery? Of course. um, but you trust your learnings and your education, your training to kind of get you through those types of scenarios and just your experience over time. I mean, I've been in private practice now for about 6 years, and you get used to things, you get better. Um, so anyway, who else? Let's take a new person's questions. Deserel's asking about my opinion on mesotherapy for hair. This whole idea of mesotherapy, it's like, well, what exactly is going into the scalp, right? They're usually like these little injections or like solutions that are placed. And the question isn't whether it's mesotherapy or not mesotherapy. It's like what's actually being delivered to the scalp, and will it have any efficacy? That's the tricky thing. So, yeah, so again, you have to know what's in the mesotherapy treatment to then figure out, is it effective or not. Someone's asking, yeah, well, wants to know, is it okay to use topical finasteride while trying to conceive? Most of my patients, I'm assuming it's a male asking that question, because if it's a woman, definitely don't want to be on finasteride if you're trying to conceive. But for a guy, usually it's best to avoid it for a few months, until a conception occurs, and then you can resume it. That's my kind of standard recommendation for guys, whether it's a pill or topical. Layla wants to know my age. How old am I? 38. Um, I did not graduate medical school at 12. Sorry. I have good skin, and you guys will see the skincare regimen. Of course, incorporating our new Feel Confident skincare products. We've got the cleanser, the facial cleanser, the HA serum, the moisturizer, and then, of course, you need sunscreen. So, we went through this regimen, and also just to give people like a pared down, like simplified routine for their morning and evening skincare, especially for the face. We filmed that video. We're in the process of still editing that video, and we're going to hold it until the moisturizer becomes available, and then we'll actually have like I was mentioning earlier, a series of these videos related to the further education videos about skincare, hair care, and specifically what's in our products and why. They're also all on our website as far as like ingredients and all that. So there's no mystery, but some people have wondered, like, well, why did you put this ingredient in? What's the reason for this or that? So more to come. But in addition to that, we have a whole new series, and I don't want to spoil it, but we have a new type of series on the channel, or at least that we're starting to film, and it's a pretty interesting format, and it's something new for me, for the channel. So I'm excited for you guys to see that format, and I really want to see what you think. Again, when you do experimental stuff, you never know what you're going to get. And some people, they see a poor performing video, and they're like, you know what, I'm not doing that again. um, I don't think about it that way. Again, for me, you guys got to realize, like, the YouTube stuff is all like extra, right? I mean, it obviously helps with my surgical practice, in that, to me, it's the most pure type of marketing, which is, I'm here to educate people. Like the stuff, they call the office, they're like, can I schedule a consultation? We meet them. If they're an appropriate candidate, if they understand, risks, benefits, um, if there's a good vibe there, we'll offer them surgery. If they're into it, they'll schedule. And it's a beautiful thing, because we get some amazing patients, like from all walks of life, all around the world, and that's a beautiful thing. But for me, YouTube is not like uh, my only thing, right? So I don't mind having some lower performing videos, as long as I feel like they're offering value to some people out there. So we had one on skin cancer recently. It was a podcast with Dr. Adam uh, Nabatian. He's a friend of mine. He's local here in the city. He's a great dermatologist, derm surgeon, Mohs micrographic surgeon, and we had a great chat for like an hour. the views are not great on that video. Uh, we're gonna adjust a couple of things with the title or whatever. But at the end of the day, I realized that you guys want to hear about maybe some celebrities and what surgeries they may have gotten, or some latest treatments for for your hair, for your skin. But skin cancer and trying to prevent skin cancer is like super crazy important. um, and we go into so much depth about that whole process, and I think it's super educational and very valuable. So once YouTube figures out and we figure out how to get it served to the right people, that's going to be great. So I'm not going to stop making those types of videos just because something underperformed or YouTube told me I got a 10 out of 10 video. 1 out of 10 means it's the best performing out of your last 10. 10 out of 10 is like it's the least well performing. But I don't really care. I'm going to keep doing it. And then someone saying because the video is too long. Yeah, maybe, but that's what a podcast is. I mean, if I'm going to sit down with an expert, we're not chatting for 10 minutes, we're chatting for a lot longer. And again, there's value there. So some people might not want to sit down for an hour, and watch our stuff. We have it available on Spotify as well as a podcast, so you can listen on there. Um, but I think some people like watching it. Like I watch certain video podcasts. It's cool to see people's like reactions and how they interact, and um, I don't know. So and then I think over time we'll get like bigger names. I mean, as the channel grows, naturally people from other spheres, they start to reach out. We've already started to see that activity, and they say, oh, I want to have Linkov on my podcast, and I can do your podcast and all this stuff. So I think we'll build up to bigger names, and that of course will carry more views. But you know uh, I, I don't really necessarily care about that either. It's just like I think good conversations, valuable information comes in different forms, and so we're going to keep delivering that. Layla is asking, your podcasts are on your channel on YouTube? Yeah, yeah. If you look through our videos, we don't have them specifically under the podcast category, so they're just like our videos. So you just go through some of the, we started posting them maybe a few months ago. Um, so yeah, check them out. They're basically the longer videos tend to be the more podcast style, and I mean, I don't sit down with people who I don't find interesting, and if I find them interesting, then I think a lot of other people will find it interesting, or should anyway. Anita wants to know about eyebrow transplants. We have a few videos on that. I'm starting to see a surge in eyebrow hair transplants. We did a video on Megan Fox recently and how she may have had that. I don't know. I was not her surgeon, but it just seems like maybe she had that. Chrissy Teigen in the past has admitted to that, and as people look to kind of counter the effects of overplucking that they used to do, or thinning those eyebrows out, now like fuller brows are more in vogue. And so yeah, I'm starting to see more people interested. What I think a lot of people don't realize on the technical side of things, even though it's not a lot of grafts, usually it's somewhere like maybe 200 on the lower end, usually to about 350 grafts per side when we do eyebrows. I mean, that pales in comparison to like the 2,800 graft, scalp cases that we're doing. But the issue with the eyebrows is that the skin is highly mobile, so it's much harder to work on. And it's a very delicate area, and it's like right in the middle of your face. So it's got to be handled properly with care. And also for eyebrows, the curl of the hair is super important. So it's not just like, you know, you're just transplanting a graft. You really need to be able to see the full curl of that hair. And for scalp, we never care about the curl. No one ever cares about the curl. We care about a lot of other things, but not the curl. But the curl at the eyebrow is very critical, because if you have the curl curling away from the skin, from the face, it starts to look, a bit odd. You want the hairs to fall close to the actual, towards you, towards the skin. And to assure that, you need to see where the curl is when you're putting the graft in. So if each time, like let's say you put the graft in and then you have to rotate the graft and you're working in this little delicate area, um, also working around, usually people have some eyebrow there too. So you're trying to blend that in. It's very technically challenging to do it well. If you just want to throw a couple of grafts in and have them grow in odd directions, easy. If you want to have a beautiful result, and something that someone will be really happy with for years to come, much harder. So those surgeries take us anywhere from like, well, we start around 7 a.m. usually for most of our hair stuff. And then like those surgeries can take us till 3 to 4 p.m. with like a lunch break and whatnot. Sometimes we'll end a little sooner, but like people don't realize that. They think it's like 2 hours and you're good to go. No, no, no. It takes time if you want them done well. All right, couple more questions. YFD, hello. She says, or he says, I now look at everyone's Traguses thanks to you. I'm a Tragus pro. That's so funny. I do mention the Tragus, especially when looking for, possible signs of a facelift, because we know the Tragus gets manipulated quite a bit, and it's very difficult surgically to exactly leave it looking like it used to. It usually goes through some changes. And again, not the biggest deal. Pens still look fine if it's done, properly. But, just something worth noting. Mark wants to know, when do you see people growing their hair in a dish to be transplanted? Lots of people trying to make this happen. It's been a very slow route, getting there. Um, I don't know is the answer. I don't think anyone does. I think everyone keeps saying 5 years is 5 years away. They've been saying that for decades. I don't know. Um, I reached out to the guy in Japan who's apparently starting a clinical trial this year on cloning hair for humans, some sort of human small like pilot study. They haven't been the most receptive to emails. Initially, they replied, and then the head guy like didn't reply, but his associate did reply, and then it was just like, I don't know. But I'm actually going, hopefully, to Japan for a vacation in the fall. So I was hoping to also stop by their lab and talk to them and maybe film a video. But, if they're not receptive, they're not receptive. I also tried to get to the Plicus lab in California, around Irvine. As you guys know, I did or maybe some of you know, the podcast with Dr. William Rossman, who's awesome, and he's hair transplant surgeon, and he helped start that Amplifica company, looking at a lot of the new types of potential drug targets that are coming out of that lab, the Plicus lab. But Plicus himself did not want to meet with me, for the record. Um, he's like, "Oh, I just filmed something with like some network in some network in Canada." He's like, "Oh, you can go watch that." Okay. So just keep in mind that some people are just not receptive to dialogue, and they just want whatever they put out in their own way to be seen, and that's how it's going to be. Uh, so yeah, I'm trying to get more answers. I've also been trying to reach out to Dr. Christina, what's her name, at Columbia. She's a big time researcher in the space as well. She's also an alopecia areata, I think, patient, and she's developed some of the early uh, JAK inhibitor solutions for my condition. So it starts with an A. Let me see. I'll tell you exactly her name. Christina. Let me see. So, I'm sure. Angela Cristiano. Reached out to her a few times. No reply. I don't know. I mean, when people who have like some, whatever, like a following or something, reach out to me with a question, collaboration idea, something, I tend to reply to them. But I haven't always gotten the same, type of responses from others, or, people are just sometimes not interested, and that's fair. Listen, for some, it might be a waste of time to sit down and chat with me. But I do think that, we owe it to everyone out there, um, to really understand what the latest progress is on developing these new treatments for hair loss and for other things as well. So hopefully some of these researchers will be more open to sitting down for conversations, as time goes on. That's my hope. What else? One more question. Let's see. Let's take this. Oh, let's take this question from Gwenks. Hello. When is it a good idea to get a rhinoplasty? My nose is very crooked, and my right nostril doesn't really work most of the time. I have been told to get it fixed, but I'm scared to get it done. Well, I mean, every surgery has risks, so you should have some element of fear, going into it. But hopefully, it's something that will help your breathing, first of all, and usually the crookedness can be addressed to a degree. I mean, there are times when it's very difficult to perfectly straighten a nose. The cartilage in our nose has memory, so you might shift something, and it might start to shift back eventually to its closer a little bit to its original position. But in the right hands, if you already have a functional problem, which is the inability to breathe through one side of your nose, that can typically be combined with also doing some cosmetic changes. And oftentimes, especially for a case like yours, they kind of go hand in hand. So it might take trying to straighten the nose, um, at least in part, to improve the breathing on the inside. So, there's occasionally we'll do surgery just for functional reasons with nothing cosmetic in mind. Um, and then sometimes it's purely a cosmetic nasal surgery for just like reducing the hump or making the tip more narrow. But oftentimes, nasal surgeries are done for both kind of indications, and one kind of affects the other. So, with functional issues, sometimes you need to make the nose a little bit bigger with grafts and stuff like that. But then that might actually work against you when it comes to like looking ideal, I guess, or more ideal cosmetically, because most people don't want their nose to be bigger. Um, so that's something to keep in mind. And when we do cosmetic surgeries on the nose to make the nose smaller, well, you don't want to start to impact the breathing and make that worse because your nose might be smaller and cuter, but now if you can't breathe through it, you might not be happy. So keep that all in mind. Guys, it's been a pleasure. Please like, if you can, this chat. That would be really helpful so YouTube can like push it out a bit. Please head to feelconfident.com and try it out. I mean, we price the products very fairly, I think, extremely affordably. We could have, just, I mean, it's kind of random, I think, where people, how they price things. Uh, I can assure you that it doesn't cost that much more to put in really good ingredients. So when you see prices on like a moisturizer that's like $200 or even $90, 100, I mean, it's a little bit inflated. But there's a balance there because if you're trying to be seen as the quality, company, then if you're too cheap, then people are like, well, they probably don't have great ingredients, right? So we tried very hard to kind of like figure out fair pricing, but I really wanted, especially for the YouTube community, I wanted people from all different places, different walks of life, different financial abilities to be able to approach these medications and to own them and to use them and to hopefully enjoy them. So try them out. Um, we have the moisturizer that will be available, I think, within 2 weeks is my guess, because of the labeling thing. And yeah, and keep us posted. Send us comments, leave reviews for the products if you can, right on the website on feelconfident.com. There's a review section. You can even post like pictures or videos of you using it or whatever. But we think this is a fun way to get a chance to like interact with people and give them like physical things. to work with. And maybe one day we'll bring merch back. I don't know if you guys remember, but this was like the original merch that we did for, I don't know, a couple of months back in the day. Uh, the I Feel Beautiful sweatshirts. Maybe some of you own them. But then we kind of moved away from merch to focus on something like more solid and again, I think more valuable, which is the products. Um, and then I don't know, we'll probably come back to at least some kind of merch. Everyone keeps asking us for something, so maybe some inspirational messages, or just, I don't know, even I think our creed is pretty much in the actual logo, and in the name of the brand, which is feel confident, right? So this has been fun. Thanks, guys, for joining me. Kind of last minute decision to do this today. And someone wants to know when I'll go live again. I don't know. I don't always have these scheduled, so we'll see. We'll see. But thanks again for all the support. You guys are great. And even if I'm not replying to everyone's comments, just know that I'm seeing lots of them. I just don't have the bandwidth to reply to all of them. I reply to as many as I can. And thank you. See you guys.